this kind of brings us also to another confluence of something that's happening in the medical space, which is the prevalence of the prescriptions of GLP-1 type drugs. Lots of different ones on the market, some for diabetes, some for weight loss. I have to tell you, like, we've had people come on the show, and similar to you, like, these are powerful drugs. They can work in certain situations. There are side effects. We have to be careful. There's an end in mind, that kind of thing. I've had other people come on the show and say, this is the next Oxycontin scandal. Like, it's going to come out because we don't know the long term, that this is causing way more harm than good. I think it's very interesting and nuanced. I love your approach to this. And so we talked about this a little bit the last time, but I want to hear any like updates. How is it going with people that are going on these medications? How have you found a way to kind of thread the needle between, getting people the proper dosage? I've also heard you recently talk about how dosages might even change. A microdosing might be an option, which I think is interesting. But
Yeah.
what things have you learned since we last spoke about GLP-1s and their usefulness and potential harms or side effects?
So, first of all, you make a very good point in the analogy to OxyContin, because dependency is certainly a risk with these medications. And I think a lot of what's going on out there is people are just getting a shot, not a lot of advice, not integrating the absolutely necessary lifestyle changes, strength training being one of them, because you're losing muscle mass, and that can lead to osteoporosis. So, the genie is out of the bottle on these medications, I think, as we mentioned last time, and I think they will be used. I think we don't know the whole story on potential side effects. Obviously, you can read about serious side effects like pancreatitis and gastroparesis, and those are certainly risks. Anybody that's thinking about using these medicines should read that list of side effects and be aware of them. The nausea and vomiting side effects are fairly frequent, but fortunately long term. And a lot of the issues associated with these medications are dose dependent, either long term dependency, or the side effects. So if people decide to look at doing this, and I'm just going to be honest with you, Casey, in my practice, there are patients that could come to me and that I might end up losing because they're so focused on these medications. So we have an intelligent, educated conversation about, okay, if you're going to use this, what is the plan? So number one is begin with the end in mind. The end in mind is not lifelong dependency on these medications. So begin with the end in mind. So what does that mean? Well, it means the same things: low carb, intermittent fasting, and strength training. And then I very much believe in what I call this microdosing effect, which is using very low doses. Let me give you a common example. The most common medicine being used, semaglutide, starts at 0.25 milligrams. It gets titrated each month up to can be as high as 2.4 milligrams. I like to stay, when I can, with patients in that 0.25 milligrams to 0.5 milligram range. So the theme is lower dosing for limited periods of time. So in other words, if you need a little restart, because I have had patients that they're so obese that they can't work out, or they have great difficulty working out. So if we're gonna go ahead and agree and commit to each other that we're gonna use these medicines, if you want to use them, the majority, I don't want to paint an incorrect picture. The majority of my patients don't use these medications, but for people that get a stall and want to look at it, or people that are in a situation where they need to get a jump start, then we'll do low doses for limited periods of time. And when I talk about limited periods of time, I talk about that being measured in months, not years.
Mm.
This integrates to the CGM conversation, because I want all those patients to do a 2-week CGM trial before they start. You come and you're overweight. We can treat the symptoms, if you will, with medication, but what's the underlying problem? So we need to start by looking at your CGM data for a couple of weeks before you're on medicine, because once you're on medicine, that data is going to be altered. Your blood sugar is going to be lower. And then we haven't talked this episode about this, I think we did last time. We need to get a fasting insulin level on you, and we need to assess your initial level of insulin resistance with that. So I like to, again, use the CGMs for a couple of weeks before we go to a microdosing schedule for people that want to be on the medication. And then the other time that CGM use becomes very valuable is, in my practice, the inevitable time that comes when it's time to titrate you down. So first of all, regarding titrating up, it's a lot easier to titrate down if your feeling of dosing has been 0.5 milligrams and not 2.4 milligrams. So if we can, again, just use this as a little boost, a little tweak to your regimen, and then we get you 0.5 as a highest dose. And I got to admit, I have gone higher on some patients, but again, we try to constrain this as much as we can. And then we bring them down again, but at that point, we start integrating CGM use again, because as they're titrating off the medicine, it becomes very important again to make sure we're adhering to the lifestyle changes, especially the low carb approach. And so people can see if they're beginning to have problems that will lead to weight regain. 60% of weight can be regained for people when they go off these medications. Now, I'll be honest with you, that's not my patient population, because I'm not prescribing these medicines to people that aren't doing the other things. But there are some internet providers out there where you just go and you get a shot, and there's no significant coaching or guidance, and you can regain up to 60% of the weight you lost at that point. And so again, if you're going to use these medicines, have your eyes open. Microdosing is the best approach, and begin with the end in mind.
Wow, thank you for explaining that. That's very interesting. On those lower dosages, do you find that they are still effective, even though it's a lower amount, or does the frequency of how often you take it change?
No, the frequency doesn't change. You take it every 7 days. I have had patients that we've been able actually to stretch it out to every 10 days. But again, the effectiveness related to an individual is variable. So when I work with people, I ask them to go in with their eyes open. We're going to be using lower doses. That means you got to be doing the work on the other side. And again, so most of those people come into this with that understanding. The individual response, though, is variable. I have had many patients that get good hunger suppression at 0.25 milligrams or 0.5 milligrams. I've had other patients that have not got as much hunger suppression. But the other trade-off here is that with lower doses, there's less side effects as well.
Right.
So
Yeah,
you can
good
avoid
point.
that. And when you get to those higher doses, nausea and constipation in particular are very, very common. So, you're just avoiding a lot of potential issues if you can keep the doses low in terms of the risk of those more serious side effects. And then also being able to get off the medicine. And as an aside, lower doses are less expensive than the higher doses.
Great point. Yeah, that's a really good point. And so, again, with your experience and helping people with lifestyle and the medications, what are you observing as far as the muscle loss? Are people able to avoid the muscle loss or minimize the muscle loss when they're doing a higher amount of protein and strength training while they're taking the medications?
Absolutely,
Absolutely.
absolutely. I mean, it becomes necessary. So I have people that come to me that have been previously strength training. They're already and high protein. They're already there. They continue what they're doing. But a lot of people, as you could guess, that are overweight have not been doing those things. That's maybe one reason they've got to where they are. And so, yeah, making sure that they're getting adequate protein and strength training. And again, a lot of times my patient population is a middle-aged overweight group of people that have not had strength training in their past, or they haven't done it for many, many years. And so that emphasis is absolutely critical, but you can certainly maintain, even increase muscle mass on low doses of this medication going forward. So, and I also view that as as a lifestyle change that is permanent. Just like low carb lifestyle can become permanent relatively easily, that this working out lifestyle with an emphasis on strength training can become just part of people's lives.
Love that. Yeah,
Yeah.
absolutely. It's such a low barrier to entry. You can pick up some bands on Amazon for a few bucks or just use body weight. You can walk to a park. Like there's so many different ways that you can strength train. So yeah, I absolutely love that. I
Yeah. Yeah. That's absolutely the way we start. A lot of my people, I just start with a $27 set of bands off Amazon, which can be
perfect.
very effective. And I also just, I don't try and solve world hunger overnight with somebody that's never worked out before. It's like, okay, let's start by getting 30 minutes in 3 times a week. Yeah, and I've had people, I can't remember if I mentioned this on your show, but I had one lady that never had worked out before, and she lost weight. This was lady without medications, just low carb intermittent fasting, strength training. She's combing her hair in the mirror one day, and for the first time in her life, realizes she's got a bicep.
Nice.
So, and that that increases, that not only helps you physically, it helps you mentally as well.
Totally.